So walking through an exercise evaluation with a client, one of the first things we want to do is take the heart rate and blood pressure. This is good for just a baseline, and pretty easy to do. Heart rate, taking the pulse, the radial artery on the lateral side, the thumb side, counting the pulse rate for about 60 seconds or 30 seconds, and then timesing it by 2 to get the heart rate per minute. Then blood pressure, cuff, stethoscope, and making sure that cuff is at heart level. You can get a blood pressure machine as well, anything that is accurate over time. Body composition is, there's a few different techniques to gather body composition, and it's not just one way. It's an accumulation of all different types of way to understand a broader scope of that individual's body composition. Height, weight, and BMI. So that's divide body weight in kilograms by height in meters squared, and that's going to get a BMI. You can be underweight, normal, overweight, or obese. And then, of course, those are associated or linked to increased health risks, depending on if you're, underweight, overweight, obese, etc. BMI does not distinguish between body fat, muscle mass, or bone. So it's not the only body composition assessment that should be taken. Circumferences and skin folds are similar in the way that the regions that are taken and the information is gathered are also associated with certain health risks. Circumferences I've seen done with my granddad, and it was cool to see his biceps go from 22 to 28 in the course of 4 months. Skin folds I've never seen done, and that technique intimidates me a little bit. I've never seen it done. It's never happened to me. So that one, according to the book, I would like to see that done in person before I try it. And then densitometry is the total body fat percentage from the whole body density using body mass and body volume. One of those is really accurate, just getting someone's weight, and then one of those is like an underwater weight, which is not as accurate. So just confirming that, to take someone's body composition, you need multiple ways in order to get there. Cardiovascular fitness is one of the main things, right? We use cardiovascular systems when we are exercising, when we do our day-to-day living, right? So the way we can test this is through either a maximal or submaximal test. Submaximal is basically determining the heart rate response to one or more of the work rates that we are testing at. And it's used to predict oxygen levels, whereas the maximal testing fatigues the client really entirely, and I would say only should be used with athletes. And you can use these following tests: treadmills, cycloergometers, and the field testing, just being outside and doing your own distance running, either maximal or submaximal, which is great. Okay, so moving on to muscular fitness. This is also really important because this can help us determine a baseline, which muscle groups may need more work or less work, or just a maintenance. The muscular strength is exerting maximum force. The endurance is performing those repetitions in succession against the submaximal weight, so not your largest weight, but just below then. That could be tested by using the push-up test, which is what the textbook suggests. Another one is muscular power, which is exerting force per unit of time. They use the example as a vertical jump. And then the biggest thing for me walking away with this was just making sure that we're warmed up. There's a dynamic stretching, that the client is familiar with their equipment, that we are ensuring correct form, posture, and technique throughout the entirety of this exercise technique and training program, and then consistent movement speed throughout the exercise. And then this is all very important because it all kind of goes together. The muscular strength, the cardiovascular, the blood pressure, the body composition, it helps detect health risks. It determines the baselines and injury risks. It determines where we want to go as the client's goals, and we can personalize the programs. And then these exercise tests are also ensuring safety and confidence in the client. we're figuring out how long you can safely exercise, and that you can perform these exercises safely and